In this video, you will learn how to doff or take off your personal protective equipment. This should be the last thing you do as you are leaving the patient's room, unless you are practicing extended use strategies, which are covered in a separate video. Before you leave the patient's room, you will begin the doffing process. The process ends by removing your mask outside the patient's room. Doffing must be done in a specific order, outlined below, and in a slow, careful manner to avoid the spread of contamination to your clothing, skin, or mucous membranes or the environment outside the patient room with infectious materials. The principle of dirty to dirty and clean to clean should be followed. This means you should touch dirty things with items of PPE that are already dirty or contaminated. For instance, you can touch a doorknob with your glove because both are considered dirty. Likewise, your gloves on the outside of your gown and respirator are considered dirty, so they can be touched, but you don't want to touch, for instance, the inside of your gown with gloved hands because the inside of your gown is considered clean and your gloves are considered dirty. If your hands get contaminated during any of the following steps, immediately wash your hands or use an alcohol-based hand sanitizer before proceeding. First, you will remove your gown and gloves together. The front and sleeves of your gown and the outside of the gloves are contaminated or dirty. Grab the gown in front, remember, dirty gloves to dirty front exterior of gown, and pull the gown slowly away from your body to break the ties and back. Avoid jerking the ties loose. As you begin to remove the gown, start pulling off the gloves from the fingertips using the outside of the gown, dirty to dirty. Continue rolling the gown slowly inside out into a bundle. Your hands will be in the middle of the bundle. As you are removing the gown, continue to work your gloves off. Your hands will be the last thing out of the sleeve. Peel your gloves off at the same time the gown is coming off, but make sure you are touching only the inside of the gloves, clean, and the inside of the gown, clean, with your bare hands that are clean. Place the gown and gloves into a waste container. Clean your hands. If you are unable to remove the gloves at the same time, which sometimes happens, continue to take the gown off. Then remove the gloves by pulling the glove from the palm of the hand into a tent and pull off so it's inside out. Wad the glove up in the other hand. Then slide the finger of the ungloved hand, clean, beneath the contaminated glove, clean, and pull the glove off inside out over the contaminated glove. Discard the gloves. Wash hands or clean hands with hand sanitizer. Next, remove the goggles or face shield. In this example, we will use a face shield. Remember, the front of the goggles or face shield are contaminated, dirty. Remove goggles or face shield from the back by lifting headband. Do not touch the front. Discard the face shield or goggles. Clean your hands. You must now leave the patient's room before you doff your respirator. Last, Once you are outside the room, carefully and slowly remove the mask or respirator. Remember, the outside is considered contaminated, dirty, so don't touch it since you are using bare hands that are clean. Grasp the bottom ties or elastic band of the respirator and pull it over the head, taking care not to touch the respirator. Repeat with the top band. Let the respirator slowly fall away from your face. If your mask has ear loops, gently remove one at a time and pull the mask slowly and gently away from the face. Don't let it swing or dangle. Place into waste receptacle or package for appropriate reuse, decontamination, or other processing, such as the Battelle Critical Care Decontamination System. Wash your hands thoroughly.